So some of the emerging treatments in small cell lung cancer, things that we are excited about are also antibody-drug conjugates, and very superficially, what are antibody-drug conjugates? These are, again, antibodies that have a protein binding domain which targets certain proteins on the tumor cells. It has very high specificity for those proteins, and then it is bound to a chemotherapy payload. So the antibody binds to the protein on the tumor cell, it gets internalized, and the antibody splits, it supposed to release the chemotherapy payload. So it's a more precision-directed approach of giving chemotherapy, so as to say. And these chemotherapy mechanisms are different. They inhibit different aspects of the tumor cells. And two antibody-drug conjugates that I think are interesting and are on the horizon or one is an AbbVie compound targeting this protein called seizure-like protein 6, or SCC6. It has a different DNA damaging payload. Recent data at ASCO showed around a 60% objective response rates in relapsed refractory small cell lung cancer. Another one is called ifinatamab deruxtecan, or IDXT, which targets B7H3, another protein on small cell lung cancer and some other tumors, where this data presented a couple of years back did show around a 52% objective response rate. So again, these are interesting data in the setting of relapsed small cell lung cancer. And I am anticipating that we'll see more of these compounds as we progress in trying to understand novel approaches. So in summary, for some of these emerging approaches, in terms of what has changed, is that we've tried to understand small cell lung cancer biology in a much better way based on evolving technologies. And we have also understood that one size for small cell lung cancer does not fit all. It has a lot of phenotypical heterogeneity. Based on last year's data from ASCO, we have now consolidation or maintenance immunotherapy with durvalumab for 24 months as standard of care in limited stage small cell lung cancer. Something that has gotten a lot of us excited is this new therapy called tarlatamab, which is successfully biting into small cell lung cancer. I do have personally a couple of patients who have relapsed after first-line treatment and were on tarlatamab and had near complete responses just a few cycles into treatment. So that's definitely very exciting, and it will likely usher a new era of therapies, a new class of therapies in the solid tumor space, especially in small cell lung cancer. And then whenever we give a therapy, we do have to understand its side effects. So managing and understanding toxicities that are associated with these bispecific T-cell engagers, such as tarlatamab, will be very crucial for medical oncologists. We've seen how we've evolved into managing and understanding toxicities from immune checkpoint inhibitors, which can start very early and can also be chronic. So I think similarly, as we try to use more and more of these bites in earlier settings, such as second line, or maybe even in the earlier stage settings, as some of the trials are currently doing, we'll understand more about managing and preemptively preventing some of these toxicities. So with that, I thank you all for your attention, and please let me know if you have any questions, and happy to discuss more. Thank you.